If you have back pain that you can literally point to with your thumb pain that sometimes shoots down into your hip or your butt stops scrolling, this video might just give you the fastest relief you felt in years. And before we get into it, make sure to like, comment, share, and subscribe so you don't miss out on more life-changing health tips just like this one. Most people automatically label this kind of pain as lower back pain, but from a medical standpoint, it's often not coming from your lower back muscles at all. The real culprit is usually a small but incredibly powerful muscle hidden deep under your main glute muscle. It's called the gluteus medius. This muscle is responsible for stabilizing your pelvis every single time you walk, stand, or lift your leg. When it gets weak, tight, or overloaded, especially from long hours of sitting or using poor form, when you lift weights, it develops what are known as trigger points. These trigger points are what cause that sharp, pinpointed pain you're feeling. So, how can you know for sure if this is your issue? It's simple. Place your hands on your lower back and slide your fingers outward until you feel two bony bumps on either side. Just outside of those bumps is the exact area where most people feel tenderness, tightness, or even a shooting sensation. If touching this spot makes your pain worse, you're almost certainly dealing with a gluteus medius trigger point. This muscle has two main jobs: lifting your leg out to the side, a movement called hip abduction, and keeping your pelvis level when you walk. When it becomes weak, the pelvis starts to drop toward one side with each step. This is known medically as a Trendelenburg gait. A lot of people who lift weights also unknowingly overload one side more than the other, creating an imbalance that eventually turns into chronic back and hip pain. Here's a quick and easy test you can do right now. Stand with your feet about shoulder width apart and lift one leg off the ground. If you have to shift your weight dramatically or lean your entire upper body to one side just to pick up your foot, it means your weight distribution is imbalanced. This imbalance often leads directly to the kind of pain you're experiencing. Alright, now let's fix it. Lie on your side and place your thumb directly on that painful trigger point. Using top-down pressure with your thumb is much gentler than using a hard massage ball, especially when the area is inflamed and sensitive. With your thumb pressing firmly on the spot, bring your top leg forward until your knee touches the ground in front of you. Then sweep it backward behind your body into extension, making sure to go past the midline of your body. From that extended position, lift your legs straight up toward the ceiling, keeping your toes pointed slightly downward. This entire sequence activates and flosses the gluteus medius muscle through its full range of motion. Repeat this movement about 10 times, maintaining steady pressure with your thumb the whole time. You should feel a combination of soreness and relief as those tight muscle fibers begin to loosen up. After a short rest, let's do it again, but with a slight variation. This time, hold the leg lifted at the top and squeeze your outer hip as hard as you comfortably can. It's interesting many people who can squat heavy weights really struggle with this simple motion. It's proof that this deep hip muscle is often much weaker than we expect. When you stand up after doing this, you should feel a noticeable and often immediate sense of relief. Now that we've released the pain, let's make sure it doesn't come back. Stand right next to a wall and place one hand on it lightly for balance. Lift your inside leg, the one closer to the wall. Let your hip naturally drop outward, away from the wall. Then use your gluteus medius to actively pull that hip back up until your lifted leg touches the wall. This exercise strengthens the muscle in the exact way it needs to work to stabilize your pelvis when you walk. Aim for 10 to 15 reps, and try to do this 3 to 5 times per week. For a more advanced exercise, you can place a kettlebell or a small weight on a belt or strap around your waist, letting it hang down between your legs. Now just walk slowly and steadily. With every step you take, the swinging weight forces your hips to stabilize against it, which strengthens the gluteus medius even more effectively. Finally, the same movement we used to release the pain, lifting the leg behind the body with the toes pointing down, can also be used as a fantastic long-term strengthening exercise. Perform as many controlled repetitions as you can on each side, focusing on building endurance and stability in that muscle. Back pain that comes from gluteus medius dysfunction is incredibly common, but with the right knowledge and consistent training, it doesn't have to control your life. Strengthening this small but mighty muscle can restore your balance, improve your walking pattern, reduce hip tightness, and prevent future flare-ups for good. If you found this video helpful, please don't forget to like, comment, share, and subscribe for more medically backed health tips that will help you feel strong, mobile, and completely pain-free. Thanks for watching.